Hi, Jake. Can you please explain what your title is, how long you went to school for, and where you went to school?
I went to school forever. Dr. Jake Berman here. It's a doctorate of physical therapy, so a clinical doctorate, not a PhD or a doctor of philosophy. It essentially means in fifth grade reading level, I'm the expert in biomechanics expert. Went to college, University of Florida for both undergrad and grad school.
Can you explain the Berman Method, where it is, where it came from, where it started?
Great question. The Berman Method is my method, obviously, my last name. I came up with it. And what I did was I took an idea that my last mentor, or my first mentor, that was my last internship and ultimately my first job I ever had, he gave me the idea of you don't really want to follow one philosophy. You want to get tools from a bunch of different philosophies so that you got all these tools in the toolbox so that you can pull from different areas to treat somebody, treat an individual, because nobody is the same. There's not a one size fits all philosophy out there, so you want to be well versed. So that's where I started with that idea of taking ideas from a bunch of different mindsets. And then it got refined even more when I had my last job in Jacksonville with Aaron Robles, where he taught me functional manual therapy through the Institute of Physical Art. And one of the most one of the most explicit things that I remember when I was learning under him was right out of the gate. When I first started training with him, he'd be working with somebody and they would keep talking about their pain. And he would regularly say, Aaron would regularly say, I don't care about your pain. I care about what your body is telling me. And that was a big, big moment for me. Because prior to that, I was really good at treating symptoms. If your shoulder hurt, I could find something that hurt and then massage it. The pain would go away and now your shoulder doesn't hurt anymore. And I thought I was doing a really good job. However, what I learned through functional manual therapy, specifically with Aaron, was your shoulder's hurting for a reason because something somewhere else is not doing its job. So let's not focus on the symptoms. Let's focus on the problem, which is somewhere else that's causing the symptoms. And that's really what spawned the Berman Method, which is for all non-traumatic pain, musculoskeletal pain, meaning it just started happening for no reason, it is extremely rare that the pain is where the problem is. So I've coined this saying, where it is, it ain't. Where the pain is, ain't where the problem is. And that's the whole fundamental or the whole basis of the Berman Method. Then I got even simpler with it and said, with back pain, it's one of the most common things that we see. It's one of the most common things that debilitates Americans. And it can get really, really complicated if you allow it to. What I've found is there's really two things that are common with 99% of back pain. One glute is not doing its job, and one oblique is usually not doing its job. And most of the time it's contralateral. So now for the Berman Method of back pain, we're going to focus on which glute's not doing its job, which oblique's not doing its job, get those things working, and that should take the stress away from what's in between, which is your back. And that's the simplicity of the Berman Method. And we just evolve that or adapt that to every other body part in the whole entire body. And that's how the Berman Method came to be.
Is there a patient that stands out to you that used the Berman Method?
That I used the Berman Method on them successfully?
Yes.
Yes. Don screams out loud right now. He's got a video testimonial on our website. Don is a guy that was a collegiate athlete, collegiate basketball player, and had broken all the bones in his hands and broken multiple things in his ankles, and had a very unique diagnosis that is very similar to MS, where there's demyelinization of the nerves, which creates weakness and all sorts of issues. When we're using the Berman Method with Don, you have to be really strategic because the symptoms will present as they are. I'll have pain in my wrist and we're looking at the wrist going, oh my gosh, it's a train wreck. It's been broken so many times and the fingers have been broken so many times. Of course it's going to hurt. But what we ended up finding was it really wasn't the wrist at all. We started working on things up in the shoulder and up in the neck, and the wrist started feeling better. This is just one example of a ton of ways that we use the Berman method on Don, because you can't just chase symptoms. My knee hurts, so I'm going to work on my knee. It doesn't hurt anymore. Okay, now my foot hurts. Okay, now I'm going to work on my foot. Okay, but you're just chasing it. It's like whack-a-mole. The thing that you have to do is you've got to remember that 99.9% of non-traumatic pain, meaning there is no injury, there is no trauma, musculoskeletal pain, is due to weakness. So you have to figure out, where is the weakness? If your left knee hurts, most of the time it's not because there's weakness around the left knee. Usually there's weakness above or below the knee. So you got to figure that out. So to come back to the Berman method, that's what we do. That's where that's where the rubber met the road, so to speak, with Don, because it was extremely complicated. If you're watching this video and you think you've got a complicated case, go watch Don's video. He's complicated. And if the Berman method can be successful with him, I don't know who it wouldn't be successful with.
Dr. Berman, you mentioned the Berman method and you mentioned a former athlete. Is the Berman method physical therapy just for athletes and former athletes?
No, not at all. It's not even for athletes. It's for people that want to find the true root cause of their problem. I know this is kind of a buzzword going on right now. However, we've been talking about this for years now, at least the past 10 years, really digging down and finding what the true root cause is. So if you don't want to rely on pain medication, injections, and you want to avoid surgery, then the Berman method is for you. If you are not looking for a quick fix and you're looking for the right fix, then the Berman method is for you. The exact opposite is true. If you're looking for a quick fix, don't call me. It's that simple. If you're just looking for pain relief, don't call me. If you're looking for pain relief so that you can get back to doing the things that you love doing, like playing golf, tennis, playing on the ground with your grandkids, walking on the beach. If you can't walk down the beach right now because your feet hurt so bad, your plantar fasciitis is so flared up, call me. If you're just looking for quick fix, temporary fix, pain relief, don't call me.
Dr. Berman, where is the Berman method today?
The Berman method is developed into a certification program where now I'm able to take anybody that comes into my world, whether you're a physical therapist, a physical therapy assistant, an athletic trainer, a personal trainer, whatever your credentials are, whatever your previous experience is, you can come into my world and I'll take you through the Berman method certification, which ultimately results in you becoming a certified Berman method movement coach, so that we all have the same framework. You can still use your own bells and whistles at the end. However, we've got a framework that works 99.9% of the time. When you follow this protocol, you don't go to step 2 before you pass step 1. You don't go to step 3 before you pass step 2. When you follow the Berman method protocol, it works. So when you come in for back pain, we're going to check this, this, and this, and then you can do the icing on the cake. So the Berman method is really objectified now, versus previously it was kind of subjective and it was kind of hard to replicate it. It wasn't really scalable because it was reliant entirely on me. Now things are documented. We're getting as close as we possibly can to copying McDonald's, right? There's a reason why McDonald's is one of the biggest scalable operations in the world. Not saying that we're going to do that. What I am trying to say is, the more reproducible we can get, the more consistency we can get with our results, the better product we'll be able to provide.
For everybody watching this video, what's one thing you want them to know?
The biggest thing is, where it is, it ain't. So whatever's hurting you right now, most likely is not where the problem is. So you can go down this rabbit hole of chasing your pain, chasing your symptoms for years. I've run into people where they've done this for 10, 20, sometimes even 30 years, chasing pain and assuming that they've got a bad knee or a bad foot or a bad ankle or a bad shoulder, whatever it is. And then once they come in here, we figure out that it's not that at all. It's something on the complete opposite other side of the body. So for everybody watching this, if you want to really figure out what it is that's causing you to slow down, what it is that's giving you that aggravation, that pain that you're feeling, that's really limiting your ability to get through the golf ball, play with kids, play with your grandkids, walk on the beach, tennis, pickleball, or just feel younger. If you're feeling older than you think you should be feeling right now, this is for you. We're going to figure it out. And the best part about all of it is we usually know within the first 20 minutes what the problem is and how long it's going to take to fix the problem. So it's not something that's going to take a whole lot of time to figure out.